Hi friends, I'm Dr. Harsha. I represent Smart Vision Eye Hospitals. I'm a pediatric ophthalmologist. In this lockdown, most of us are attached to these gadgets like phones and TV, mobiles, etc. Especially the kids. I see my daughter most of the time in front of the TV with a mobile in her hand or in any kind of these gadgets. This is a point of concern actually. So I thought I'll give some tips to the parents so that they can at least try and avoid the issues related to the eyes because of these extended screen time. What I'm recommending is give breaks at regular intervals, restrict the consistent or long-term use of these screens, give them breaks, maybe 2 hours in the morning, and give a break 2 hours in the evening. You can also give them artificial tears, lubricating drops at regular intervals. These drops will help at least prevent dry eyes and give them comfort. You can also use ice cubes wrapped up in a cloth and just put them over the lids with their eyes closed at regular intervals. Please avoid them rubbing the eyes. Make sure they don't rub the eyes too much. In case you see them rubbing the eyes or blinking too much, try to avoid the gadgets, because extensive screen time can cause a lot of dry eyes and give this kind of irritation, and they start rubbing and some kind of issues can start. So use lubricating drops frequently. Over the market you can get them, like easy to remember is Refresh Tears, Tears Plus, Tear Drops, something like that. You can refrigerate them and keep using them on a regular basis. Anybody in the house can use it. And restrict the screen time. Most of the parents, like both husband and wife, are busy, so sometimes we don't actually try and observe the issues arising or in our kids, especially vision related issues. And these kids, they don't complain. As a kid, they don't complain that they have an issue. So once they start going to school and start seeing the blackboard, that's when the actual complaints arise. And sometimes it can get a little too late by the time you go to a doctor. So some tips that parents can observe, that in case they're getting their books too close while reading, or in case they're going too close to the TV when they're watching the TV, that could be a small hint that he might require an eye checkup, he or she might require an eye checkup. Just observe, because there's a condition called lazy eye. Between the two eyes, one eye is better, the other could be a weaker eye. In case we don't detect the weaker eye early and try and treat the eye properly, that could worsen up. And by the time you come to us, it would be too late. So earlier, the better. So yearly once eye checkups for kids till around age of 10 to 15 years, I really recommend that. After that, maybe you could be a little more casual about it. But at least till the age of 10 to 15 years, I would say yearly once eye checkups mandatory. Yeah. And also keep observing the eyes of your kids, if they go inward or outward, which is called the crossed eyes or squint. In case of this kind of thing happening, then also it's an important thing that you should get your kids to the doctor.